Hello everyone, my name is Anna. In my presentation, I'll be discussing how AI and data analytics are shaping and changing the healthcare industry. I'll be giving examples on how AI is being used on a daily basis, demonstrating current news on topics, and discussing advantages and challenges that come with involvement. I will also be sharing my personal thoughts on what I think the future will look like and hold for AI and healthcare. AI is becoming one of the most important technologies in healthcare. Hospitals and healthcare providers are using AI to improve patient care, detect diseases earlier, reduce admin work, and make faster medical decisions. While the implementation of artificial intelligence has many benefits, there are also concerns involving privacy, security, and bias that healthcare organizations have to address. Healthcare organizations use AI in many different ways. Artificial intelligence can analyze X-rays and MRIs. They can predict patient risks before the problem even starts. They can recommend personalized treatments, organize medical records, automate schedule and billing, and even assist patients through virtual chatbots. Doctors can also use telehealth and Zoom appointments to help patients if needed. These tools that AI offers can help doctors spend more time focusing on patient care instead of stuff that delayed them from giving the patient effective care from before. As mentioned before, there are many benefits of AI in healthcare. This includes faster diagnosis, greater diagnostic accuracy, improved patient outcomes, and reduced healthcare costs. One of AI's biggest strengths is the ability to process huge amounts of medical data in a quick amount of time. This aids doctors in diagnosing illnesses earlier and more accurately before waiting for something to happen to the patient. AI can also help admin with reducing paperwork, improving hospital efficiency, lowering costs, and allowing healthcare providers to manage better staffing and patient resources whenever they need. In my analysis, I used various different amount of articles that I found on Google Scholar. More recently, there has been an immense amount of news about the involvement of AI in healthcare. The news articles I found talked about how healthcare organizations are quickly adopting AI tools, especially generative AI. Hospitals are now putting their money and time heavily into these technologies because they can improve productivity and patient care overall. These things include growing adoption of generative AI, increased investments in AI technologies, concerns about patient privacy, and importance of human oversight, and government regulations that continue to develop overall. These are all things that healthcare professionals should be ensuring that remain involved and important in medical decisions. Besides the advantages of the implementation of AI in healthcare, there are also some things that pose challenges and ethical concerns. Some of the major concerns that I've listed are patient privacy, HIPAA compliances, data security, AI bias, lack of transparency, and over-reliance on AI. Since this medical information is highly sensitive, protecting the patient privacy is extremely important to keep the trust and the well-being of the hospital overall. When using these AI systems, one should watch out if they can contain bias, if they are also trained on incomplete data or incorrect data. For these exact reasons, healthcare providers should always review AI recommendations rather than just relying on them completely. AI involvement should be a partnership. Moving forward to my own personal analysis. While doing my research on this topic, I did start to believe that AI should support, not replace medical professionals, as I mentioned before. I think that human judgment still remains essential on this topic, and ethical AI implementation is still necessary regardless of how much and how many benefits AI does give. Continuous monitoring still improves the trust with the patient and the hospital, and responsible adoption will make sure that the benefits are being maximized. Regardless, AI should be viewed as a tool that supports doctors and nurses instead of completely replacing them. These healthcare decisions made by AI still affects people's lives, so human experience and judgment will always be necessary. Healthcare industries that use AI responsibly while maintaining transparency will likely see the long-term success. Although the implementation is starting to happen now, the future of AI in healthcare will be very bright. With looking ahead, I believe there will be more personalized medicine, there will be earlier disease detection, remote patient monitoring, AI-assisted surgeries, improved data analytics, and stronger regulations that concern patients and admin staffing. As AI gets more implemented into healthcare, you can expect more personalized treatments and overall. As AI continues to evolve, the government and healthcare organizations will also strengthen regulations to ensure patient safety and ethical use, to keep patient trust, and to maintain the strong ability and the use of AI technologies. My key takeaways from this presentation is that AI is always going to be changing healthcare now that we've implemented it. It will continue improving efficiency in patient care. Ethical concerns should still be addressed regardless of the implementation that is happening. Human oversight should also remain essential, and AI does have a promising future when used responsibly. I do think artificial intelligence has the great potential to significantly improve healthcare by making diagnoses that are more accurate, reducing admin work, and improving patient outcomes. Although with these benefits there are more ethical and privacy concerns, responsible implementation with the combination of human oversight will allow this AI to continue transforming healthcare for the better, for the patients, and both for the staffing.